Hi, everybody. This is Dr. David answering questions about coronavirus and back to school. Next question, how can I get my child to wear a mask and keep it on? Now, of course, great question, something that a lot of people have been struggling. Hopefully, people have been doing practice over the summer times and even for the last week to get their child more used to it. If a child is not comfortable keeping it on for long periods of time, then using what we kind of refer to as an exposure therapy type of approach, where, and especially with a special needs kid, and I have lots of even lower functioning children with autism who are able to keep the masks on, but it's a gradual process. So, as with exposure therapy, how taking the individual steps and breaking them down and getting them comfortable with one step before you move to the next is very important to that. So if, for instance, just having a child hold the mask, feel the texture of it, make sure that they're comfortable about it, so when it touches skin elsewhere, that it's not a new experience. And maybe spending a couple days doing that, even just starting off with 10 seconds if that's all a kid can handle, and then moving up to 20 seconds, 30 seconds, minute, and expanding it on further. It can take a while to get there, but usually that type of desensitization is something helpful. So once the child is comfortable touching it, maybe having it just covering their face, not putting the straps around it, but then again, just for a few seconds on or off. However, the child will be successful with it at that moment, but also try to catch them before they take it off so that they're successful. So if they leave it on for just 3 seconds, you take it, oh wow, that was a great way of doing that. Thank you so much. That was wonderful. Now let's try it again for 5 seconds or whatever. And so again, success breeds success. So if your kid seems a little antsy, that's the moment to take it away and praise them for doing that. So as far as another thing is comfortable. If it's not comfortable, it's not going to be good. So the material, some people like certain types of materials, some people like other types of materials. And then, of course, the fit itself. So masks that have a wire type of rim around it, one that can keep it. You can see here that when I pinch my nose around here, I can keep it staying on my face without even, which is not going to be successful as a filter, but it stays on until it falls off. Another thing about it is, comfort around the ears. So I know that some people have a lot of issues. People such as myself with sensory issues will go crazy after a while having it right around the loops. Now, there are ones that go around the head. They typically could be a little tighter, and some people don't find them as comfortable. Some people may. But what I have found to be most successful is one of these very inexpensive silicone straps. And when I put this on, I actually am able to have this not even be around my ears at all. As you can see, I have it kind of kept more at the base of the neck, but I'm still able to keep a very good mask. You can see the seal is very nice on both of the sides. I'm able to keep it. Now, if people do have glasses, what I do is I actually bring the my glasses just onto the rim of it, and also a little bit away, because then there's no fog that can build up there as well if that's an issue for people. But you'll notice that I do have it underneath here as well. And one other thing is, I do not encourage people to twist the straps. When people do that, and I've seen it, what you start to see is that there'll be like an outpouching here, and then air can be escaping or getting in as well. So just twisting that just seems to make it the seal not be as good. All right. Well, thank you for watching.